Are you worried about numbness, tingling, and pain in your hands or feet? Are you continuing to struggle with constant sharp, burning pain day in and day out? Tired of the medical merry-go-round running from doctor to doctor guessing what medication might help? Here, try this drug. Didn't work? Oh, well, try this one. If this sounds like what you've been through, this short video can make all the difference in your quality of life. My name is Dr. Mark Gould, and my practice specializes in internal health and functional neurology, and I've got good news to share with you. Hundreds of people in our community who've suffered, like you, have found relief. If your neuropathy does not have to be a one-way street of taking stronger and stronger medications in order to cover up the ever-increasing pain. Have you ever wondered how many more nights will your legs twitch as the nerve endings die off? How much longer will you be able to walk before you need a wheelchair to get around? How bad does it need to get before you take action? In the years I've been treating these types of problems, I found that most people really don't understand what their options are. They think that their choices consist of taking medications that don't work, continuing with therapies that are ineffective, trying expensive surgical procedures with disappointing results. Most believe that there isn't anything they can do. They just have to live with the problem. Well, it's time to break out of that box. If we can get to the source of the problem and allow your nerves to heal, you might have a fighting chance at overcoming this disease. I want you to know that there is new hope, that you can give yourself a chance through these new diagnostic and treatment methods I'm about to share with you. What allows me to speak so confidently with providing you with real relief? Well, I've been working with some of the top physicians around the country who specialize in nerve health and the treatment of peripheral neuropathy. By completing advanced studies in functional neurology, functional blood work analysis, neurotransmitters, and functional endocrinology, I've become one of a select group of doctors helping neuropathy sufferers using these diagnostic methods and cutting-edge treatments. These methods and treatments represent a true breakthrough in neuropathy care. And here's the best news. It's never too late to start. It doesn't matter how long you've had your neuropathy, what doctors you've seen, or what medications you've taken. And the reason it doesn't matter is that I'm going to look at you and your condition like no one else ever has. Peripheral neuropathy is a disease of the nerves outside of the spinal cord that carry information to and from the brain. The name of the condition really doesn't tell us what's wrong with the nerves. It only identifies the problem. And just because you feel a symptom in your hands or feet, well, that doesn't mean that's where the source of the problem is. And this is a huge, gigantic misunderstanding about the condition and a big reason why the diagnosis and treatment of peripheral neuropathy goes wrong right from the beginning. Has any other physician ever told you what your nerves require to return to health and then to stay healthy? The key to what your damaged nerves need to recover and stay healthy is proper fuel and proper activation. And this is the cornerstone of our neuropathy recovery program. Unlike most other doctors, we treat you and your condition both neurologically and metabolically. To understand the true source of your neuropathy problem, I leave no stone unturned. I'm going to uncover all the parts of your nervous system that are not functioning properly through the most comprehensive exam process you've been through. It will tell us specifically about areas of your nervous system that are affected and what it will take to get them functioning optimally again. Next, we're going to run metabolic tests because metabolic factors are often the cause behind nerve destruction. One very important one is food sensitivity testing through a new lab called Cyrex Labs. If you have a sensitivity to gluten, milk, or other cross-reactive foods, research shows us that it could be fueling an autoimmune process that is destroying your brain and your peripheral nerves. Until recently, this test for gluten was not available to the public, but we now have them. We'll also run a complete blood panel, including a thyroid panel and specific antibodies test, a complete metabolic panel, a lipids panel, and a CBC. With the results from these tests, we'll be in a position to access the function of many of your body's systems. Any and all of these can be the cause behind your chronic health conditions. By looking at it at a functional level, we can find the real cause behind your conditions, help your nerves to heal faster, and restore your good health. Once we have understood your unique biochemical picture, we can then apply cutting-edge treatment technology to get recovery underway and to really help you regain your life. Based on what we discover from these tests, specific dietary changes may be necessary, along with targeted nutritional supplementation. We'll use specific brain-based therapies to restore proper neurologic function. These may include things like vibration therapy and other neurologic exercises to activate nerves and restore normal function. We are also the first clinic in Illinois to use the LightCure deep tissue laser therapy system to speed healing to chronically damaged nerves and to relieve pain. We may also use non-surgical spinal decompression to create a negative disc pressure and take pressure off a compressed nerve in your neck or your lower back. The slow stretch of this therapy increases the stimulation of the brain, which is actually vital in your recovery. We also use a specialized form of microcurrent therapy, a clinically proven medical device that sends a very comfortable electronic signal to the areas affected with neuropathy. It restores, strengthens, and rebuilds the nerves of your extremities. We also will use interactive metronome, a computer-based biofeedback neurologic rehabilitation device, which is a phenomenal tool in balancing the brain and restoring normal functions such as balance and coordination. So if you're tired of dealing with this problem and worried about it becoming worse, order my free Neuropathy Recovery Program Kit and learn more about your condition and how we can help. Just fill out the form on the left of this video window. To schedule 2 free visits with us, include your phone number so our staff can contact you, or call us at 847-550-1818 and we'll get you set up for your first appointment. Thanks for watching.